class. Today we're continuing our anemia discussion. Specifically, really do have to make so much noise.
Sorry.
Okay, as I was saying, take out your notes for the anemia chapters. Our first anemia today, no cell phones in class. What did I say? So where was I? Today's anemia is an autosomal recessive disorder with a trademark shape from abnormal hemoglobin. These cells are hemolyzed by the spleen, leading to anemia. This abnormal shape of the red blood cells causes oxygenation problems to organs and limbs.
Does this mean that both my parents have to have the disease to pass it along to me?
Yes. Autosomal recessive means that it is a recessive gene that both parents carry, that it is given to their offspring when both genes are passed along.
I read that it's more common for African Americans, Mediterraneans, South and Central Americans, Caribbeans, Indians, and Saudi Arabians to carry this gene.
Yes. In certain ethnic populations, this recessive gene is more common. As I was saying to you, the gene causes abnormally shaped red blood cells to be produced and circulate through the blood vessels.
So would the abnormally shaped cells lead to a blockage in the vessels because they don't flow like normal cells?
Actually, yes. These red blood cells are stiff and sticky, and with this, there is clumping in the vessels and decreased blood flow to the rest of your body, leaving tissues oxygen deprived because the abnormally shaped cells don't carry blood like they should.
I really don't understand why that's that big of a deal.
Major organs require oxygen. Major complications will arise when the organs that need the oxygen most do not receive adequate amounts. Did anyone do the required reading and know what one of the biggest problems for this patient with this anemia?
Of course I did. Obviously, Chapter 31 in our textbook said that infection is a major cause of morbidity and mortality in patients with this anemia due to the failure of the spleen to phagocyze foreign substance as it becomes infarcted and dysfunctional from the abnormally shaped cells. It also becomes smaller due to all the scarring termed autosplenectomy.
Wow, well listen to you. Does anyone know the most common infection caused by these complications?
Infections in the lungs because that's where all the oxygen is going.
Correct. Acute pulmonary infections including pneumonia, tissue infections, and fat embolisms, characterized by fever, chest pain, cough, pulmonary infiltrates, and dyspnea. These can lead to pulmonary hypertension, an MI, heart failure, and ultimately cor pulmonale.
Wouldn't all this trouble breathing hurt the rest of the body then?
Yes. Patients with this anemia suffer complications with vision, heart failure, renal failure, and strokes from vessel occlusions. Patients can have bone pain, jaundice, and delayed growth as well. The skin can reveal chronic ulcers from the hypoxia to the tissues as well.
Well, what's the problem with all that?
With all these signs and symptoms and complications, it can lead to chronic pain for patients with this anemia.
Wouldn't the lack of oxygen make their skin grayish with pale mucous membranes or possibly yellow from their jaundice?
You clearly read up on this subject. Does anyone know how you can diagnose this disease?
Wouldn't you just look at the blood?
Correct. Blood smears to detect hemoglobin S, the trait that each parent passed along, are a way to determine this anemia. When exposed to a deoxygenation agent, it can be determined if these cells are abnormally shaped. X-rays, MRIs, and Dopplers can be used to assess the extent of complications caused by this anemia.
So how do we help these patients?
Hydrea is a chemotherapy drug. It's #1 drug of choice to increase the hemoglobin and the volume of red blood cells. It also helps to prevent them from sticking to the endothelium. Also, supplemental oxygen will help stop further abnormally shaped cells.
The textbook says that stem cell transplants are a definitive cure for this anemia.
Yes, you are right. However, stem cells are a limited resource. Because of this, blood transfusion, oxygen, and pain medications are the first-line treatments.
So what should we teach our patients to help themselves then?
Drinking plenty of water, avoiding high altitudes, prevention of respiratory infections, pain control, and folic acid supplements are all things we can recommend to these patients to help promote comfort while coping with this anemia.
When I take care of these patients, I know I can use the diagnoses impaired gas exchange, acute pain, and risk for infection to help each one of their specific needs.
Well, that was a productive class. Good job today, everyone. I hope you're all informed on today's anemia.
Did she even say what the anemia was?
Oh.
Con los terroristas.
And do the Harlem Shake.